Hi, Dr. Jeda. It's so great to have you here on the Mind Myself website, and that your profile is featured and that you're doing this interview. It's just great to have you as part of our community.
Hi, Esther. I've been actually really excited about this project that you're working on. So thank you for inviting me.
You are so welcome. Well, let's just dive into the questions. And I know that the person watching you today is saying, okay, who is Doc Jeda? What's she all about? Tell us a bit about your credentials, because I don't even know what they mean. I've seen them a bunch and I don't know what they mean. And then how did you get into this career?
Okay, so it gets a little bit confusing because there are 3 licensing exams for the Chinese medicine track, and that's why people are like, well, what does that mean? Why are you an acupuncturist and you're also an herbalist and a doctor of Chinese medicine? So in BC, we have 3 levels where you write a licensing exam for your acupuncture and your herbology. And when you have acupuncture and herbology, both of those, you're considered what's called a traditional Chinese medicine practitioner. And then there's a 3rd licensing exam that's called the doctorate, and then you become a doctor of traditional Chinese medicine. So then you're an herbalist and an acupuncturist, and then also there's a lot of Western medicine and that kind of thing on the doctor, but it's not the same as doing like becoming a Western medical GP and that kind of thing. It's more along the Chinese medicine track. Then I also have what's called FABORM, which is a fellowship in the reproductive field, and it's more, a lot of people in Canada have it, but it's a US credential, and it's for fertility and reproductive medicine, essentially.
Awesome.
Yeah.
And why did you choose to go into this whole career path?
So there was many different ways that I came to this career path, but I grew up with a mom who's very much into holistic, like, nutrition. She's a nurse, and she was always, stay out of the hospitals and as much as you can, only go there if you have an emergency, and just stay healthy and make sure you're eating well and getting lots of exercise. And I was always really interested in her career and reading her nursing books and reading about nutrition and herbs and so she knew I was interested in healthcare. So she actually used to take me to the hospitals and have me spend a day with a physiotherapist or an occupational therapist, or go meet the candy stripers. And so, she knew that I had a passion for healthcare. And she actually married a man that was a emergency room doc. And when he was transitioning out of being an emergency room doctor, he became a family doctor. And he and I used to talk a lot about like medicine and herbal medicine and herbal remedies. And then he decided to study acupuncture. And so he would practice acupuncture on me, and I became very interested in acupuncture as well. And then I thought, you know what, I actually think I want to, because I thought I didn't really know much about going through medicine from a holistic side when I was like growing up in Saskatchewan, and it wasn't as prominent there. But then coming here, I learned more about naturopathic medicine and Chinese medicine, and I thought, well, maybe I should be a naturopath, because I didn't know much about Chinese medicine. But I didn't really want to leave Vancouver, and there was no naturopathic college here at the time. And I mainly wanted to learn herbs and acupuncture. And I thought, oh, well, why don't I do the Chinese medicine track, see how I like it, and, do it for a year. And if I don't like it, then move on to something else. But I loved it. Like, it took me about 3 months to kind of wrap my head around some of it. And then once I did, I was like, oh, this is amazing. I love this system. So I was really happy that was the path I took. I feel like I'm really lucky that I have the best job in the world. Like, I just got lucky getting into this career, and I was really happy about that. So totally
That's so
resonated.
cool.
Yeah.
And tell us about your ideal patient or client. Who do you most love to work with?
So I work with a lot. I work with a lot of men and women, and I work with some children. The type of patient that I work with the most would be females between about 35 and 60, maybe 30 and 60. Because I do a lot of reproductive health, that tends to be the most common demographic for me. And a lot of the patients I work with are very self-motivated. Like they're a lot of them are willing to make changes to improve their life. They're many of them are transition, like they're either trying to have a baby and they're having trouble, or they're having issues with their menstrual cycles, or they're going through menopause and having hormone fluctuations. Thyroid is a huge part of that. That's the main thing that I do. I do a lot of sports medicine as well. I love to treat pain and pain management and injuries. And I think part of that is because I'm active and I've kind of feel like I've had a lot of the injuries and I need some of that treatment myself. So I actually enjoy helping people get out of pain and helping them manage their, like just their function and movement and that kind of thing. So.
Awesome. Are there any other focuses that you do that you haven't mentioned yet? Or are those the primary ones that you
I would
use?
say I do a lot of things. In Chinese medicine, you're not really treating a disease, you're treating a human. So you're, if someone walks through the door, it doesn't really matter what they have. I mean, I care and it matters, but it's not, in Chinese medicine, you're treating the person anyway. So, we do a lot of skin and digestion and that kind of thing. A lot of times though, I'm treating someone, they might come in, say they come in and they're having they have endometriosis and a lot of pain, or they're not getting pregnant. We treat the whole package. So there can be digestive issues, sleep issues, things like that.
Got it.
Yeah.
And on a personal note, how do your friends and colleagues describe you as a person?
So, I mean, this is kind of a interesting question, like talking about myself through someone else's eyes, right?
Yeah.
But a lot of the things that my patients say is that they feel that they can trust me. They feel like my presence is calming. People are often comment on my commitment to ongoing learning. I'm fairly rational and logical, I think.
Yeah, that's my experience of you.
Yeah, I don't really sweat the small stuff.
Yeah.
Little things don't, I don't know. Non-judgmental is another word that patients have said. And I do care about everyone, and I care about everyone on a level too. Like I care about their life. Like I want to know, what do they do for work, and what's their family life like, and what does their daily activities look like? And I'm very interested. This is one of the reasons I feel like I have the best job in the world. I get to meet so many different people, and so many people from different backgrounds and different jobs and different experiences. And I love just learning about people and what they do and that kind of thing. So
awesome. Thank you. And what would you say to somebody watching today about an initial session with you? What does that look like?
We set up the initial, it's about 75 to 90 minutes. I have them fill out a form before they come in, and it's quite an extensive form, but it depends on what we're working on. So for the example, like if we're working on thyroid or fertility, there's a lot of questions that I need answered. I don't need answered in that, but we go through a lot of things because we're going through all of the processes in their body. We're doing, working on, like I need to know like how their digestion is and how their energy is. And I like to know things like what kinds of foods do they eat? What do they crave? Body temperature regulation. So it's a lot different in that there's a lot of detail. And then when they come in, I take that detail and then we even hone it down even further. So because we're looking for patterns, there's a lot of information in symptoms and signs and looking at the tongue and taking the pulse.
Excellent. having been the recipient of some of your services, I can vouch for your thoroughness, and it's really amazing.
Oh, thank you.
So after a session, do you also prescribe supplements, or do you sell those in the context of your office, or do you refer people out for those kinds of things, or both?
I do a lot of herbal medicine. So we do, I often, not always, but often somebody will go home with a herbal formula, Chinese medicine. There are some supplements that I use. We do have a naturopath that works for us. So she specializes in those types of things. Like she does a lot of like hormone panels and things like that. I used to do more of that, but now that I work with a naturopath, it's nice for me to refer those things to her. And then occasionally I might suggest a supplement, or people sometimes will bring in their bag of supplements and be like, do I need to take all these? And we'll just go through it.
Oh, that's great. That's so helpful.
Yeah.
And what do you personally do in your life to stay healthy?
I like to keep active and eat really well. I eat tons of vegetables. My favorite is big salads and soups.
Hey, me too.
Yeah, I know. And soups in the winter I love. And then in terms of keeping healthy and active, I mountain bike, I play hockey, I ski. There's, and I'm almost every day I go to the gym. I don't go to the gym every day, but I try to do something fairly active every day.
Yeah, you're pretty strong.
We're taking that. We're taking the office bowling tonight.
Oh, that's awesome.
I don't know if it counts as exercise, but
for sure, why not? That's awesome.
Yeah.
And we're almost finished here, but what's something that you're most grateful for in your life?
My health, for sure, and mobility.
Yeah.
And like I said, I'm really grateful that I have the job that I have. And the people that I work with are amazing.
That's great.
So yeah.
Cool.
Yeah.
Well, as we wrap up, then what's one thing you'd like to leave your listener with today? Something inspiring, or something that inspires you?
I think one of the things in terms of this type of medicine is that it's not generally, I have patients that come in, like I got a call this morning. I have a patient that has a back spasm, and he's going to come in. I mean, I've been seeing for years, and he'll come in and we'll deal with that. And so that's kind of like the quick fix. But in general, this kind of medicine isn't a quick fix. It's more of a lifestyle medicine. And for me, it's like finding kind of the big picture of what motivates you to live a healthier life, and have kind of people you see, or coaches that, because I mean, I'm not really a coach, but I have patients I've been seeing for 20 years, and they like they'll come in when they need to, and I do the same thing. I have practitioners I see, so I feel like I have a team of people who help me when I need it, and it keeps me mobile, keeps me active, and I want to stay that way for many, many years. My mom's almost 80, and she still bikes like a couple thousand kilometers a year, and she skis still, and so she's inspiring to me, and I hope to that I find my patients can be very inspiring too, and I hope to inspire people to stay healthy and active in their life. Keep mobile, because we're going to need it. We got to put our socks on. Sometimes it's hard to get your socks on in the morning when you can't bend your hips, right?
Right. We have to always keep our socks on. Or put our socks on.
Put your own socks on. Like, put your own socks on. I want to get you to the point where you put your own socks on.
Oh, that's great. Thank you so much, Jeda. I really appreciate your time. And for the people watching, she's an amazing practitioner. Check her out.
Thanks, Esther.